Welcome everyone. Welcome to our Zoom program. And today we will have a couple of items in the agenda. So without ado, I'm gonna ask Dr. Mohammed Makkawi to present the first topic. It's about rehabilitation. So thank you so much, Dr. Mohammed, and welcome everyone.
Hello, everyone. My name is Dr. Mohammed Makkawi. I'll be giving a brief presentation about rehabilitation. So what exactly is rehabilitation? It's a structured, goal-oriented procedure where we try to restore, maintain, or at least to improve the physical, mental, function of an individual after an illness or surgery or a disability. And it has a lot of interventions. Usually they're designed to optimize functioning and to try to restore as much function as possible so that that patient will be able to to fulfill his life without much help. So there are many types. There's like physical or occupational or speech, cardiac, pulmonary, neurologic. And there depends on what type of injury or insult the patient has, we will give a focused rehabilitation. So what are the main things about rehabilitation is that it has to be individualized. It should be tailored depending on the patient, about his health conditions, about his goal and his lifestyle. And it has to be multidisciplinary. Usually it will involve doctors, therapists, nurses, social workers, psychologists. And it has to be goal-driven. You have to have a specific goal in mind. For example, if someone has an injury in his hand, our aim may not be that he will be able to use his hand completely 100% like before, but at least he should be able to feed himself, he should be able to cook, he should be able to open the door by himself. So at least some part of, it has to be a specific goal oriented. And then it has to be, of course, evidence-based. We don't do anything which is not evidence-based. So it has to be shown that this particular rehab has been shown to be proven to be effective, and it has proper progressing tracking ability. And it also has to be holistic. It has to be, keep in mind the patient and his body, his emotions, his physical and emotional and social needs. So let's talk about some of these rehabilitation. We'll focus on 3 of them: stroke and rehabilitation after surgery and cardiac, since they're the most common 3 afflictions that happens with patients. So in stroke rehabilitation, usually it's a program which is designed to help those who have suffered from a stroke and trying to recover from the effects of a stroke. One thing to keep in mind is that rehab does not reverse the effect, it does not reverse completely the effect of stroke, but at least it helps to restore as much function independence as possible by relearning lost skills. This is because there is an ability in the brain known as neuroplasticity, in which the brain is able to rewire itself. Then, so the main goal is to improve daily living and to prevent complications and enhance quality of life. We want to make the patient to be as independent as possible. And rate of recovery varies from patient to patient. Sometimes it may take weeks, some take months, some may even take years. So why is it important? Well, if we do a proper rehabilitation, it will help the patient to regain abilities such as walking, speaking. Many times we have seen in the ER patient who presented with stroke, they will have power 0. They're unable to move the limb at all. Then with the help of rehabilitation, if you see him after a few months, after a few months, you find him able to walk again. May not be perfect as before, but at least he's able to work and do his day-to-day activities. And then, of course, stroke has its own issues, and it can cause secondary risk issues such as muscle stiffness or depression, or it may even cause another stroke. So we have to, so with rehabilitation, it will help reduce these complications, and also helps to promote independence. In the end, we don't want more people to be completely dependent on others. We want them to be more independent. And Of course, and like I mentioned before, rehabilitation is a holistic approach and involves both physical, mental, and social support, and it affects as especially because stroke affects the person as a whole. So there are many therapies such as physical therapy. They help with walking exercises, occupational therapy, so that he'll be able to do his day-to-day activities such as dressing and cooking. Speech language therapy, because one of the most common cause, especially if it is an anterior stroke, one of the main presenting symptoms is that he's unable to speak. So with speech language therapy, he will be slowly able to relearn to speak and also to able to protect his airway so that he'll be able to eat safely without choking. Then there is cognitive therapy, which will use brain games or puzzles to improve his cognition. Psychological support, usually they may have, there's a strong association between stroke and depression. So with counseling, we can help relieve these issues. Then there is vocational rehab. For example, if someone works as a construction worker, they can give them specific job skills training so that they will be able to slowly go back to work. Then we have rehabilitation after surgery. This is structured, usually targeted to allow proper healing and regain function and strength and reduce pain and return to daily life as early as possible. Usually it starts at the same day and it continues for weeks or months depending on the surgery itself. So why do we focus on rehabilitation after surgery? It allows for faster healing as it promotes blood flow. It also restores movement and prevents stiffness of joints, especially if it is a musculoskeletal surgery, and reduces pain because with movement, patient is able to the contraction will reduce, and it prevents complications. Well, we studied before in medical school about the complications about the 5 Ws. So with such as wind, water, these post-op infections actually gets reduced when we involve rehabilitation. Then it also helps to improve outcome, leads to better long-term function and satisfaction. Also, just as a note, without rehab, there will be prolonged disability, re-injury, or chronic pain. So usually they're divided into phases. Phase one is the acute phase, which happens usually in the hospital immediately after the surgery. We try to reduce the swelling with icing and elevation. And then the phase two, out in week 1 to 6, we start to recover the patient with PT/OT sessions, which will improve the muscle strength. And then phase three, try to restore completely the muscle power with resistance bands and weight training. And then phase four usually depends on how long does it take based on the surgery. So if the person, for example, an athlete, he may have to try to do rehab focus on his particular occupation. And like I said, the timeline varies by surgeries. It could be 6 to 12 months. Sometimes it could be days. So, like I mentioned earlier, usually any form of rehab is a multidisciplinary team with surgeons, physiotherapists, occupational therapists, with nurse wound care, pain specialists, because pain is actually one of the main reasons why the patient may not be willing to do any form of exercise or any form of mobility. So, with proper pain management, you'd be more likely to be involved. And then just cardiac or pulmonary therapies if the patient had any lung or heart surgeries. Then finally, we have the cardiac rehab. As we all know, the cardiovascular disease is one of the leading causes of mortality, especially in the Western world. And so cardiac rehab is something we will frequently see in our day-to-day life. So here we try to provide a supervised program to help them recover from a particular heart event and improve heart health and reduce the risk of future problems, which combines education, counseling, and exercise, which is also always tailored to the condition of the patient. It has been shown to reduce the risk of another heart attack, lower readmissions, and help to boost energy and mood and quality of life. So usually cardiac rehab is done for those who had an MI, or heart surgery, for example, cabbage, or heart failure, those who have, especially those with reduced ejection fraction, angina either stable or unstable, or those who had implant devices. Usually, Medicare and most insurances, they cover up to 36 sessions. Sometimes it can go they can cover up to 72 cases if they are high risk. So what are the most important things in cardiac rehab? Exercise training. You have with exercise, it will help to strengthen the heart and improve the stamina, usually done by a treadmill or a bike. Education. Again, the patient education is very important so that you can teach them habits that will help him to reduce stress. For example, a proper diet, medications, how to take his medications, and it's very important to take them on time to reduce stress and smoking cessation. Then counseling. You have to manage. You may a patient with usually a heart attack or an MI is a very stressful condition for the patient. Usually they have this feeling of impending doom. So important counseling is very important for them to reduce depression and stress. And support groups are available that will also help them. So usually, again, just like any form of rehab, they have phases. Phase one, usually in the hospital, they start 1 to 2 days after the event. And here we just go for a light activities, just like just walking in the hallway. Once the patient is fit and is fit for discharge, we follow them up in the outpatient setting, usually in a rehab center with monitoring. Normally, it lasts for 12 weeks with 3 sessions in a week. And then after that, they go for a maintenance. Here they can. Here it's long-term, lifelong, lifelong phase. Usually they do it in the home, or it could be done at the community gym, and it's self-directed with regular follow-up with your GP. Then again, we have risk factors. Usually, we know that myocardial infarction or any cardiovascular disease have certain risk factors. We have to control them, otherwise the patient may develop another event which will make his condition much more worse. So we have some targets we'd like to hit. If the patient is diabetic, for example, we would like his A1C to be less than 7%, his blood pressure to be less than 130/80, cholesterol, and diet. With the DASH diet, especially, is shown to be by studies to reduce to help control the blood pressure, and then even some cases that they are cured from hypertension by following this DASH along with supervised exercise. A general rule of thumb in exercise is 150-minute exercise per week of moderate intensity, and of course, smoking cessation. So these are just some advices we give to the patient. So if they feel, we advise them if they are all during exercise, if they feel any chest pain or dizziness or extreme shortness of breath, they have to stop, and they have to be regular in taking their medications and be sure that they hydrate well before and after exercise, and avoid heavy lifting if they had any sternotomy surgery for at least 6 to 8 weeks. Again, we give patients red flags if they develop any crushing chest pain or sudden severe shortness of breath or fainting or irregular heartbeat. We advise them to call the ambulance at 999 so that they can be seen. So that's briefly about my presentation. Thank you so much for listening. If you have any questions, I'm ready to listen. Thank you very much.
Thank you very much, Dr. Mohammed. And any questions for Dr. Mohammed? So I'm going to add some points. Thank you so much for this great presentation. So basically, you're going to find these patients when you are at the hospital. If you are doing internal medicine, if you are doing family medicine, sometimes surgery. So what you are going to see, all the adults with certain conditions, let's say they have some weakness, some falls, some fractures, they are having surgeries. So sometimes they are not able to go back to their living situation, if they are living in a house, an apartment, and so on, if they are living with family or living alone. So certain limitations um, might prevent them from going back to the baseline, as Dr. Mohammed mentioned. So they go to a rehab center, and in these centers, they get the rehabilitation. We have different types of therapy there. One of them is physical therapy, occupational therapy, and speech and cognitive therapy. So for people who has upper extremity surgery, for example, they have a fracture and they are or they were using a walker before the fracture. After the fracture, let's say they did a surgery, they're not able to use that arm for using the walker. So they are not going to go back to their baseline or their home situation. So they may send them from the hospital to the rehab center. In the rehab center, what they do, they will work with them with strengthening exercise, for example, after the healing of the bones, and they're gonna work on how to hold the walker the right way, how to lift if it's a mobile walker, and so on. If they had a fall and fracture of the extremity, lower extremity, they may need a surgery, and after surgery, they may not be able to walk the same way, or maybe they are not able to go up and down the stairs. So they may need to get some also rehabilitation. This is called the physical therapy. So occupational therapy, basically, we can use the upper extremity for dressing, combing the hair, using like toothbrushing and so on, feeding. Lower extremity is physical rehabilitation or physical therapy. That's for walking, going up and down the stairs, transferring from, let's say, the stool or from a chair, from the bed to the wheelchair, and so on, walking with a walker or a cane. All these are dealt with physical therapy. And then some people might have stroke or might have some cognitive problem or delirium, and then they are not able to communicate. Or they may have swallowing problem. So they will be seen by speech and swallow therapy or cognitive therapy. What they focus on to maintain or to improve and get back the baseline of the patient ability to, let's say, eat and swallow without increasing the risk of aspiration. And there are certain techniques that they can use and educate the patient about, and they practice, as well as other components like cognitive either improvement, enhancement, and maintaining the cognitive level. So they don't want them to deteriorate, for instance. So they work with them on these areas. This is what is called subacute rehab. Like you see the patient at the hospital, and then the hospital team, they will tell you, we want to send this patient to a subacute rehab or SAR. So you need to recognize what happened at the other end, because most of the time in other countries, like in Sudan, for example, we don't do that. The patient will be sent home after surgery, so they can deal with it with families and they can recover there. Here, most of the time, they will send the patient to the subacute rehab, and then the patient will spend a few weeks, a couple of months, and then when they go back to their baseline, then they can be discharged home, and they can go to their baseline home and apartment or house or something. This is how it's done. So the staff at the hospital, they will keep asking you, are this patient ready for rehab? Are they ready for subacute rehab? So you need to understand what is required from you. So at the hospital, they have also teams similar to the subacute rehab. They have physical therapy team, they have occupational therapy, and swallow or cognitive therapy team as well. And they see the patient, and recent studies showed that the faster they see the patient and encourage the patient to move around, the shortest will be, or the shorter will be the stay and duration of the stay at the hospital. So this is one of the qualities that most of the hospital, they want to see the patient, admit them, and then discharge them as soon as they can. So they can get the turnover faster. They can get money that way better than length of the stay that's long. So the longer the patient stay at the hospital, it's not going to be productive financially for the hospital. So they want to get these patients as soon as possible out of the hospital so that they can have beds available for another patient and so on. So you need to understand why the push from the staff at the hospital. They want you to discharge patients as soon as you can safely, what I mean. So the social worker or case manager, every day they will come during the meeting in the morning or after the meeting. They will tell you which one are you going to discharge today. So they can prepare the discharge paperwork and send these paperwork to the subacute rehab facility. I'm gonna give you an example here. At Sparrow Hospital, for example, in Lansing, we have the internal medicine team residents around on the patients. So they have a floor, let's say 8th South floor, and that floor mainly for the patients that covered by this internal medicine residents. So there is a case manager or social worker for that floor, and each morning she will go and see which patients are ready or almost ready to be discharged. And out of these patients, which ones will need some help, either rehab in a form of physical, occupational, cognitive, or dysphagia, and so on, speech. So they will come to you and tell you, this patient seems to be ready in 2 days. Do you agree? And what's the plan? So if you agree, the patient will be sent to a subacute rehab. Then this social worker or case manager will communicate with these facilities, because in Lansing we have, let's say, 8 or 9 nursing home or rehab center. So they need to contact some of them to see if the beds are available for that patient in the coming days. And then they will send a report about the admission and the progression of the patient, progress of the patient during this stay at the hospital, so that the administrator or the team in these facilities, the nursing homes or the social and the subacute rehab center, will review this paperwork and say, yes, we have this bed available and we have the staff to accommodate for this patient. Or they can say, oh, we don't have a bed available. So they will go, the case manager will go and approach a different center. And by that, they will find a place for the patient when the residents are ready to say, tomorrow we're going to send you out of the hospital. So the plan will be discussed with the case manager. The case manager will say, yes, I'm ready to make everything ready with this rehab center. So the patient will go from the hospital directly to the rehab center. And then they need to also arrange for the transportation. So they will arrange for some way of transportation from the hospital to that center. Sometimes the family can provide that transportation. Sometimes there are companies that they will take the patient from the hospital to this center. So this need to be arranged at least 1 day prior to the actual discharge. for that patient. So you want to understand what's behind the scene for you guys. So you not only focus on, I'm going to give this patient antibiotic, I'm going to give this patient this and that medication, but also what the plan, because if this is not in place and you send the patient, let's say, directly home, and the patient are not able to function and go back to their baseline and do whatever they need to do on a daily basis, guess what? They will go back to the hospital. And then the hospital will be penalized for retaining this patient to them. It's called rehospitalization. So this is one indicator, one quality indicator for the government. When they pay the hospital, they will see how many patients were sent home, let's say, and then came back within 90 days. So if this is the case, they will investigate and see, did you send the patient with the right medication? Did you send the patient to the right setting? If you don't, then they will not pay the hospital. So you want to understand the other factors that you as a trainer or trainee in this hospital, you have a big role if the hospital wants to get some money or to support itself. So this is one of the things that it's called transition of care. You need to understand that as well. As I said, in other countries might be different or might not be available at all. So in this system here, in the healthcare system in the US, you need to understand the concept and what the role of internal medicine or family medicine, for example, or surgical resident in sending the patient out of the hospital. If the patient is able to function well and doesn't need a lot of therapy, then that's fine. They can go directly home, and then they can arrange for home therapy. What's the difference between therapy at the rehab center and therapy at home? Or they call it outpatient therapy. The difference is the time, duration, how long time they spend with a patient. So there are three types of therapy, depending on where the therapist will provide this therapy. The first one is inside the hospital. It's called inpatient rehab. For the inpatient rehab to occur, they need to have the patient able to spend at least 40 minutes or 1 hour with each of these three types of rehab. For therapy with physical therapy, so they can spend 40 to 60 minutes a day, and the same with, let's say, occupational therapy if needed. So if the patient is not able to tolerate this long time period, then they will say, no, you are not fitting to stay for inpatient rehab. We're going to send you to the subacute rehab, which is a different center out of the hospital. So they send you to the subacute rehab, where the patient in these centers, they will spend some time with the therapist. That time probably will be half an hour a day for each type of therapy. So half an hour with physical therapy, half an hour with occupational therapy if needed, and half an hour with speech and cognitive therapy if needed. So they need to be able to spend this time with the therapy there. When they meet the criteria to be discharged from this rehab center, they will go home and they can have therapy that's come to their home, or they can go to an outpatient therapy center. But usually the insurance will cover 3 days a week for that. So they will spend half an hour either at home, or they go to the center, outpatient center, and they spend, let's say they need more rehab physical therapy. So they either go to the center as outpatient, they spend half an hour there 3 times or 2 times a week, or the therapist will come home and then they will work with them about, let's say, a up and back, up and down the stairs, or moving around in the house, getting out of bed and back to bed, and so on. So they will work with this strengthening exercise, the muscles and the balance and so on, half an hour, a couple of times a week, not every day. In the rehab center, it's every day, 5 days out of the week, for example. In the inpatient rehab, it's about also every day, so maybe 5 days or more during the week. So just to understand the concept of rehab in the US. And this is related to everyone, but mostly it affects older patients. So patients who really fragile or have multiple problems, medical problems, they may need a rehab, and they either get that inpatient as inpatient rehab, or they will get it as outpatient, like in a center or so. It's a subacute rehab. Rarely or occasionally, the patient will be sent from the hospital directly home, and then the rehab will come evaluate and give some support or rehab at home. So just understand the whole concept of that. Any questions? Thank you so much, Dr. Mohammed Makkawi, for a great presentation. Any one of you did any experience? Did you see any patients with rehab or here in the US or outside that needed some type of rehab or therapy? What's your exposure? What's your experience if you saw family member or any patients during your rotation, during your observership or externship, if any, in the US or maybe in the Gulf area or other places?
Hello, Dr. Nader.
Hello, Hiba, go ahead.
Hello. Thank you for your informative session. Yes, I did go with my aunt in the Gulf area, Qatar, for rehab center to do physical therapy. She was suffering from multiple sclerosis. So basically, the management was considering just to increase and maintain her strength in the upper and lower limb. And that's all. They didn't do speech therapy or other things, but they just focused on maintaining the ability to move her limb, upper and lower limb. That's it.
Excellent. Thank you so much, Dr. Haifa. So thanks for sharing the experience. And I'm going to share my own experience. So a few years back, and I was shoveling the snow here in Michigan, and I slipped and I broke my arm. So I had surgery, my left arm. So they sent me home because I have support. I have my family, my wife and kids, so I can do many things, but if I need to, there is some support at home. So what they did, they set up an outpatient rehab, as Dr. Haifa mentioned. So I went to occupational therapy in a center as outpatient 3 times a week, and the goal is to, as she mentioned, to keep the strength or improve the strength back and the range of motion. So for me, how can I move my arm back to the same ranges? Because with the pain, your body will try to minimize that and limit your ability to move. And this can cause multiple problems for the patient, especially if you are older. You can get arthritis on the joint that's not moving. And sometimes they may get a condition where, for example, the shoulder, they call it frozen shoulder. They will not be able to go all the way, for example. And to prevent that, you want to continue with some sort of therapy, range of motion, and to make the function well, you need to do some strengthening exercise. But thank you so much, Dr. Haifa, for sharing the experience, your family member experience. Thank you. Anybody else?
Thank you, Dr. Nader, for sharing what's the reasons why the hospitals don't like rehospitalization. I recently started like a house physician job here in New York. It's just a training. So when I went there, there was a patient with diabetes and multiple complication. Kidney function was creatinine was 4 and severe hypokalemia. So the thing we wanted to rehospitalize the patient, but what I realized that nursing home and nurses like was refusing, and we were afraid like from atrial fibrillation, from anything happening because of the severe hypokalemia. So thank you for explaining more why they don't like to rehospitalize. Now I understand the penalties and the thing that happened to hospitals.
You're welcome. Yeah, thank you for sharing your experience as well. Yeah, so what happened, like I go to a nursing home, for instance, and I'm one of the medical doctor or the medical director in one of these centers. And we have the team. Remember, I told you there's the communication between the social worker or case manager at the hospital and the case manager or some of the staff member in the nursing home. They communicate so that they make sure the patient will be discharged to the facility. And if this facility, for example, they don't accept because we have full, we don't have any beds, then this hospital will not communicate further with this center in the future. So the center will not have good communication. It's kind of business-wise. So they need to accommodate the hospital. And as at the same time, if this center keeps sending the patients back to the hospital, then the hospital will say, we are not going to send our patient to this center because our rate rehospitalization from this center, rehab center, is not going to be beneficial for us. So what happened in one of these centers that I go to, they have meetings between the two teams from the hospital and from the nursing home, and they communicate as far as what and how we can improve this relationship. And one of the things is, in the past, they have different EMR, so they needed to find a way of sending patients information, let's say discharge summary, in a timely manner to the nursing home. So the nursing home staff will have the information and they can act or prepare themselves for the patient coming. Let's say a patient on IV antibiotics. So the hospital will send the patient to the rehab center for administering these IV antibiotics. So the nursing or the center, the rehab center, they need to know what antibiotics that patient will be on. So their pharmacy will bring that antibiotics right away. Because if the patient arrives and then the staff will figure out what antibiotics, they call the pharmacy will say, we already shipped our medication today, we're gonna ship the next medication tomorrow. So the patient will stay in this center for over 24 hours until they get their antibiotics. This will put that center in big trouble with the government because they can say this delay of treatment and the patient may die because of that or whatever. So they will be penalized for that. So it's very important to think about what the importance of communication between the hospital and these centers. One thing, when I was resident, I used to discharge patient, let's say, and always I have a case manager who comes to every one of us, the resident, and say, hey, I need the discharge summary right now. And we are still rounding on other patients in the ICU or on the floor. And these case managers, like after us, did you do it? Did you finish it? And so on. And we did not understand the concept of, I can do it at the end of the day. Why the rush? The patient will be discharged, let's say, at 4 o'clock or 5 o'clock. So they try to explain to us that they need this discharge summaries so they can send it to the rehab centers. So the rehab center will be on the same page as soon as the patient arrives. They can take care of that patient and without any delays in management and so on. If anything happens, guess what? They will send the patient back to the hospital, and then the hospital will not be happy. But thank you so much for sharing your experience as well, Dr. Limia.
Thank you, doctor.
Anybody else wants to share their experience or input? Any questions? If not, then thank you so much again, Dr. Mohammed, for great presentation. Anything, Dr. Mohammed, you want to add?
This is actually a very interesting topic in general. Because like you have mentioned, you have added everything more than what I have said. So there's not much to add. But overall, it's rehab actually is important. Why? Because like I've said, for sure, all of us will see such patients either in our clinics or in the hospital. You may have a patient who's underwent a cabbage procedure, and then he will, like maybe us as cardiologists, we may see someone with we do the procedure, but we should know what happens to them after the procedure, how they are followed up, and how they're doing after that. So I believe that this topic is very important for all of us to have a great idea.
Excellent. I do agree. All right. So for the next topic, I think we supposed to talk about how to use Grammarly and other writing tools. I'm going to share the screen just to make sure we are on the same page. So number 2 is Grammarly, and then we will talk a little bit about time management and maybe interview skills. I'm going to stop this here. So Grammarly, any one of you use this tool? It's like an English editing tool that will help you if you make any like typos or suggest some improvement in the sentences when you write sentences and so on. Like in the past, Word, Microsoft Word, they have spelling checks. So after you write something, you can check the spelling, excuse me, and it will go and highlight the words that are not properly spelled, for example. Anyone of you used Grammarly?
Yeah, I'm using Grammarly now in my essays. I usually mainly I use it for two things. They can help in fixing your grammar. If you're not very confident in your grammar, you can copy paste your passage, and they can fix any grammar with conjunction, or if you use the wrong conjunction, or if you use the wrong adjective, they can fix it. Another thing that I use it is for paraphrasing. If you feel that you're using the same word over and over, I'm not sure about what word to use. With the paraphrasing, you can it'll help you give a guide on what words you can use instead of the words that you're using. So I'm using it a lot, and it's very useful. Just one thing, there's a free version which is commonly used by everybody, and then there's a paid version. It's just the paid version uses AI. So if you're for example, if the program that you're applying or or anything that you're applying to requires that you should not use AI, just beware not to use the paid version, but just use the free version.
Thank you so much for sharing, Dr. Mohammed. Yes. Anyone else?
I used that for the eras, but now with the chat GPT, I've just like less this year.
Yes.
Yeah, it's very helpful.
Sure. So I'm gonna just share the screen with you again. So if you want to use it, it's Grammarly, and you go to grammarly.com and you can sign it, or you can sign in, or you can log in using, for example, your Gmail, if you have a Gmail. And these are some of the things that you can use. In the past, it was only for like spelling check and improving the grammar or the sentences, but now they have AI detector, plagiarism checker, and so on. So within the tool itself, they incorporated AI improvement. So this is one of the things. So if you go to their website, you can just sign with, let's say, Google, and then you go ahead with that, for example. So if you have a document where you want to write your abstract and so on, I'm gonna upload, for example, a document that's we worked on in the past. So just for showing you, so you go to upload, and this is an abstract about a systematic review. So we're gonna do it here. It will open it, and it will look at the text, and maybe it will suggest some alternative and so on. So here we go. So in the blue, it will give you what seems to be, maybe instead of affecting, maybe you can write bowel disease that affects. So if you want to accept it, you can just click on it, and it will change the affecting, for instance, to that effect, and so on. So you go to the next, and it will show you what the suggestion and so on. And instead of significantly, let's say, going here, and so on. So my mouse is not working well. Let's see. Okay. So here, significantly, what's that? So the space, for example. So there is no space between the comma and the word here. And if you leave it, it will just highlight it as a red. That means it's not just error with the spelling, it's with the spacing. So you need to pay attention to that as well. So it will help you with some of these things. One thing you can do, as mentioned, you can use ChatGPT or any AI tools to do the same. So for example, I can just copy this paragraph and go to ChatGPT, and then I can ask. So what I did in the past is I'm gonna ask the ChatGPT for this text. I want you to the AI can create tables. So for me, I want the AI to create a table in the first write the sentence, second column, So in the first column, I want the AI to write the sentence from this text. And in the second column, I want to have an improved version of the sentence or enhanced version of that sentence. And then in the third column, I want a reason why you think it's an enhanced sentence. And here I'm gonna ask the AI or show the AI the importance of this text. I plan following professional. So it will understand that I'm writing in a professional way to a journal, if that makes sense. So it's gonna analyze every sentence. It will tell me which sentence can be improved, and it will tell me the reason. So if I hit here, you will see that so here's the table. So the original sentence, and then the improved sentence. And if I go, so this is the way. So mainly it added some improvement to the sentence here to elaborate further, to highlight further the importance of this topic, for example. So for me, it will help me if I want to improve on the actual sentence here, if I add a little bit more. But keep in mind, sometimes they will ask you on the word count. So it will improve the clarity of your sentence, but at the same time, it will add, let's say, more number of words. So pay attention, because sometimes when you submit an abstract of an article, they want you to be, let's say, 300 word or 1 page, for example. So this is how I did it in the past. I will ask, write the sentence, write the improved sentence, and the reason why this is need to be changed, if that makes sense. I'm gonna stop here and see how, if you used AI, what did you use? We have a couple of them. ChatGPT is very common. Gemini, Google Gemini is another one. And we have DeepSeek and other Grok and so on. Which one did you use if you use for writing? Anyone can share their experience. Go ahead. Limia, you are muted.
Yes, doctor. To me, usually I use ChatGPT more these days. It's just amazing for everything, for studying, for like writing articles, for the eras, for everything. Yeah.
Excellent. Yeah, I do agree. It's very, very useful tool. Anyone else? Anyone use ChatGPT or Gemini for anything in your daily activity, in your application, in your writing, in anything related to research or unrelated to research?
Yeah, I just used Grok to help me with the presentation. just made. It's good because it can make a lot of information in the form of tables instead of just blocks of text. So it was very good for making presentation.
Excellent. So you use the free version, I take it, for this presentation, or the paid version?
The free version.
Yeah. So you can use, as Dr. Mohammed said, Croc is one of the tools. If you want to get similar presentations, you can also use Canva. And I'm going to show you, for instance, so if you go to canva.com, it's another way of doing. So you go to Canva and you create a new, and you want to create a presentation. And then there is an AI tool where it will show you, if I can find it somewhere here. Design generation. This is you can design your slides, or you can use some of the templates. Let's say I want to use this template. It will give you how the template will look like. So I want everything here. So this is your title and so on. But it has a way of doing the whole thing. I'm gonna go back to create, and then let's see. So if you go here, the main box, for example, write so let's talk about transition of care. We just mentioned about the rehab, and we touched base a little bit of transition of care. So I want some presentation. So I'm gonna ask the AI to help me with that. So you click on AI, and then you design that. So you can hit enter, and it will analyze this for you, and it will write you the background, the title, and so on. Okay, educational, maybe 15 short pages, something like that. And it will, as Dr. Mohammed mentioned, it will create the slides for you. Sometimes it will create even the tables, the text, and so on. If you want to improve it, let's say you want to add more, you can add slides, for example, or continue view or something like that. So this is how it will think about, and it will create the slides for you, if that makes sense. So for any of the topics, let's say for next week, you want to present something, then you can get Canva or Grok or ChatGPT or Gemini to help you write the whole thing. So each of these will have some points, bullet points, and you can divide, let's say, this into different. If you want to edit the section, you can move the slide to whatever place, and so on. When you are done, it will generate a slide for you. All right. And then you can select which type of the slides and so on. It will take a few minutes, but finally, it will give you the whole presentation, and you can get that uploaded, for example, and so on. So this is a presentation. So transition of care. Next page about what the topic about, like, and so on, challenges and risk, and numbers and tables and whatever. So this is how you can create a presentation, and you can edit wherever you want to update and so on. So this is how you use AI for presentations. Similar to Dr. Mohammed, he just used Grok, is one of the AI that also is very useful. Any questions, any comments? Go ahead, sorry.
Sorry, doctor. Is Canva free or like paid?
It has two, the free version I just show you, and it has a paid version when you use it for different things. I was trying to use it for, let's say, image enhancement. I'm gonna show you, I think I'm going to show you, for example, I want to enhance one of the images for, so this is Canva. If you want to, let's see, I want to design social media or for photo editor, for example. I want to crop this. I want to remove the background, for instance. So if I hit this, it will show it's a paid version. I have to upgrade. But if I want the free version, I can click on it, and then there is a tool where I can edit and brush whatever here, and it will remove that for me. It's gonna do the same job, but it's different ways, if that makes sense.
That's very nice. Thank you, doctor.
You're welcome. Any other questions, comments, or any experience that you want to share? Tools that you used?
Hello, Dr. Nadir.
Hello, go ahead.
I used ChatGPT in a personal statement and in my CV when I applied to the recent scholarship in Edinburgh. It's very effective. Another thing, you can also ask him to evaluate. For example, if you wrote the personal statement and you want him to evaluate or give you percentage from 100, he will evaluate it. Last one, there is it.com that is more, it's also AI, but that is more, what is called? It is more than ChatGPT. When you do search on it's it.com. When you do any search, he very give an very informative information reference, and you can download that as PDF or Word if you want. So that is very effective than ChatGPT, because in ChatGPT you need to do copy paste. And another things also I want to highlight, when you do anything in whatever document, for example from ChatGPT or any AI, if you do copy paste or download it, you need to, there is a space that, for example, when you apply to any organization, they have the also AI tools to check if this you wrote it by yourself or it is used chat GPT on it. There is space that between the word. So just when you do any copy, just the space, try to what we call rewrite it. What we do in the research, for example, when you just have the idea, but we resend the word or we try to make a difference. That is, yes, that is my experience.
Excellent. Thank you so much for sharing this. It's very useful when you use it for your personal stuff. And it's helpful if you are submitting to, let's say, an abstract or manuscript for journals and so on. But you need to be aware of the AI detectors. So, and sometimes you can use some tools to find out how much what you wrote is considered AI generated. It will give you a percentage, let's say, this is 80% AI generated. So you need to modify, as you mentioned, rephrase some of the sentence, and you work on that and test it again and see if it comes down to maybe 20%, then the journal will say, yeah, we can accept. If it's more than 20%, then they will reject your manuscript. Or sometimes the journal, they have in the author page, they have some guidelines, and for the AI, they can say you are not allowed to use AI, or you are allowed to use AI, or in between, we can accept up to 20% of AI generated text, something like that. So you need to follow their guidelines when you are submitting to these journals. For the abstract, I think some of the conferences, they may use AI detectors, but sometimes the volume of abstracts, they may not use it because they want to accept as much, as many as possible for their conference to be successful, for example. So they can give you feedback, or they can tell you, hey, can you elaborate on this and so on. So I'm sharing with you because recently, in the last month or so, we submitted an abstract for one of the conferences. It's about sleep. We send a case, and they send back to add more information about the case. So they want to elaborate on if you have more data on this area, want more data on this area. So they have certain questions, the reviewers, they want to see if we can fill in the gaps. So the abstract will be accepted and presented in that conference, and so on. So, but yeah, pay attention that when you use AI for generating some of the sentences for you, there are some AI tools that they can detect and maybe put your work at disadvantage if you submit to a big of journals for like paper or submission and so on. Thank you, Dr. Yusra. Anyone else? So the next topic, it's very brief. It's about time management and the tools that you can use while you are a resident. So I wanted to see if you can, in the coming days, maybe you can help me. If you have any senior fellows or fellows that, or residents that match in the past year or the years before, they're working in the US, can you reach out and see what tools, what they use for managing their patients? Because back in the day, we used paper and pen to list how many patients I have, what I'm going to do next. I'm going to study for this and do this. But nowadays, with the phones on your hand, you may have certain apps that they help you manage your time effectively. You want to study for half an hour a day, or you want to do this and do that, to-do list and so on. So there are certain mobile applications that they may help you. So if you have anyone in the US who is working, see if they are using any of these tools, and you can come and share it with us maybe next week or the week after. Anyone uses from this group any of time management tools on your PC, your laptop, or your phone? So the fourth topic, we will discuss about the interview skills and tips. So I know some of you are applying for this year, maybe some will apply for next year, and you need to prepare for the interview. You want to make sure test your camera, test your light, test your background, make sure the voice is clear. You can record yourself on your computer, for example, and make sure you have internet connection and backup. If you have a phone, you have a, um, let's say, a hotspot in case your connection has problem, then you can use another um, internet provider or access so that you don't miss your interview session. How do you answer these questions? We know there are common questions that they will ask you during the interview. I shared an app where we listed a couple of these questions and few answers, like example answers that you can use. So if you want to, maybe you can try it and see if you practice using these questions. And what you need to do is you need to practice with someone, your family members, your friends, any one of the fellows in this group, in this program may help you. Maybe you can be the program director, the other person will be the candidate, then you can flip the roles. You can be the candidate and then the other person will be the program director, and you can answer the question and see, and you can give feedback for each other. See if you want to elaborate on sentences, or if you want to discuss certain areas, you want to work on your body languages and so on. So anyone applying this year, what's your input? Can you share? Thank you.
Yes, I applied this year, and unfortunately, it's like not the first time. Um, yeah, I trained on interviews couple times. So new thing also, I like this time I like trained with ChatGPT and it was doing good job. So, but be careful, just not say a lot of personal information, just like information you need like to tell them about interviews.
Excellent. How about person to person? Did you do any mock interview?
I did the last year with a couple of friends. It is very helpful, like someone like say what you're doing right or wrong or how you are answering. It's very useful, yeah.
Excellent. Very good. Thank you for sharing. So it's very important to practice as well. So as I mentioned, the camera and the other person will pinpoint certain things that you may not by yourself recognize. So it's very important to have an extra eye. And the more people you interact with you, the better. If you have seniors who match, they can give you a better feedback, who knows the system better, for example. Or if they had experience with interviews in the past, let's say. So they will say, this one question I had last year, and I answered this way or that way. There are some questions that they may just pop up, and you need to react to these questions and make sure you just be yourself, be honest, and show them that you are a team player and you are a learner and you want to do your best so that you improve the health and well-being of your patients while improving yourself and training and improving your clinical skills, your knowledge and so on. So thank you. Anybody else wants to share their, if you are applying this year? I know it's early for the interviews. Some might have invitations and some invitations are on the way. So anyone wants to share? Thank you.
Hello, everyone. How are you?
Dr. Eric, go ahead.
I'm also applying this year, and I'm working with we select certain questions every day. We do some questions, and every one of us, for example, maybe ChatGPT, and then we conduct a meeting daily for 1 hour or 1.5, and everyone share his answer, and we comment on each other's answers. And yes, we are planning now to start a real mock interview. And we also have some feedback from seniors, some residents who also volunteer to arrange for Zoom meeting. And, from the advice.
Excellent. Thank you so much, Dr. Eric, for sharing, and I wish you all the best. Excellent. So for anyone who wants to join, maybe you can ask Dr. Eric for more information. You can start similar Zoom group where you can have some of the actual residents. They can give you feedback, or you can work with other fellows or other friends. It's very, very helpful when you are on the spot and people will give you feedback. So thank you.
You're welcome. Thank you.
Anybody else? So for the interview itself, I want to share with you, for example, you can use some of the available videos online. I'm going to share my experience in the past. So I was asked to present something in one of the meetings. So my approach was to look at the US presidents when they give their speech. So I wanted to look at how they deliver their speech, how they show their confidence, they use their hand gesture and so on. So I tried to learn from that. Although the video itself might be, let's say, it's for a certain topic, and I don't want to go that. I just watch the video, not for the content. I watch it for the body language and the expression and the sentences where they, let's say, change from one topic to another, and so on, connecting words and so on. So I ignored the political part of the text or the message, but I focused on what I need from the video. For you, you may use, for example, Mamdani is working to become mayor of New York State. If you look at his videos, some of them he uses his gestures, and some of them I want you to focus on how he uses his smiles, his face, his looking at the camera, and his message. Last example for me, when he was interviewed in one of the like Fox News, the interviewer on this side, he is on this side, they are facing each other, and the camera is on the angle, so his part of his face on the camera, and when he answers the interviewer, most of his face facing her. But when he wants to address the people or a certain person, he moved his face with a smile. He is answering or he's addressing the camera face to face. And I want you to see how you can manage these subtle or very small details when you are answering a question. So, for example, during the interview, you can face the camera and be just in one place, and you can, yes, you can nod your head, or sometimes you may use your head a little bit while you are answering. So maybe some of you may put some notes on the screen so that you can remind yourself or certain points that you want to address. So you will move your head one side or the other, and sometimes you may look down, look up. So all this, pay attention to the interviewer will follow you. And when it's a very important aspect of the answer, I want you to face directly the interviewer. One thing also you may need to show the interviewer is you are thinking about the answer. Sometimes you know the answer, don't deliver it right away. So you can say, for example, this is interesting question, and you pause and then you give your answer. So as if you are thinking deeply and you are sharing your whatever answer, your experience, and this subtle movement maybe you will learn from watching some of these videos, interview videos for big names. Maybe just a tip for you guys. Thank you.
Thank you, Doctor.
You're welcome. So for the next part, I want to ask if anyone of you have any updates as far as projects that you are working on. I hope every one of you is working on at least one research project or aspect of a research project. Can you share with me what you are doing, guys? Thank you. Anyone, you can jump. Thank you. So maybe I'll ask you this way. Any one of you developed a mobile application? Did you work on area of a mobile application that can be used by certain group of patients? Anyone wants to share? If you did not, that's okay.
Hello, Dr. Nadir.
Hello, Dr. Knight, go ahead.
Sorry. Regarding the project, we are working on continuous glucose monitoring, the Dixocam. So that project, we are now done with data collection and analysis. We're about to start the discussion section. So I think we hope by the end of this, maybe next month, we are going to submit it.
Excellent. What's your target when you say you're gonna submit? Thank you.
So because now mainly on the discussion, we have some aspect we need to revise it. There is some area we need to go back and revise it, and then the discussion group will start the discussion. And then I think after that we will see your input, and if it will be ready, then we are going to submit it.
Excellent. So I take it as the final product will be a manuscript that will submit for a journal, like an abstract, like a paper format. Is that correct? Like an article?
Yeah, exactly.
Yeah. Okay. And some people will work on different type of projects, and the target will be a conference, so they will submit an abstract. This is why I asked. Thank you. Excellent. Thanks for sharing.
You're welcome, Doctor.
Anyone else? So some of you might be new to this program, but we require you to work on some of the projects, and at least you want to be part of one project, because learning about the research, if you don't do it, it's going to be just way up, and you're not going to learn, and you're not going to practice it when you are in the ground, like when you start your residency, after residency, and so on. It's better to learn it while you are in this program. You have many fellows available, and they can help, and you can work together as a team. So let's say you don't have any idea and you want to work on a project, but we don't know what kind of project. So I'm going to share with you. If you go to the app, one of the things that we can work together on is the project icon here, and there is a list of projects that we listed for people to work on, but you can create your own. If you have an idea, you can add a new project, and maybe you can create a team. People might be interested in the same topic, and to do that, you can hit add, and then you give it a title, description of what you want to do, and then make it okay to share with other people so that it will be listed, and you hit submit. And sometimes you can say it's new project, or we are started, or we are whatever stage that you are on. This circle will have the number of people who are in that project, who are interested at least, and they can work together. So you can say, search for certain word. For example, you are interested in dementia or asthma or COPD or diabetes. You will find some studies or some projects. But if you want to, I added some projects ideas about asthma. So I think 5 of them. So let's say you don't have any project that you are working on. You search for asthma. You will have these 5 project ideas. You can click on one of them. Let's say I want to work on symptoms tracker. So you click on here. You want to add yourself. So add yourself. And here you can select, I want to be a team member, for example. And then you want to work in any area, presentation, post, draft, and then you will show yourself as a member here. You can become, let's say, delete, for example. You can become the project leader. What that means, you can work on the project and divide the task between the members. So if you have 3 members in your team, you can ask member number 1, hey, can you do this? And member number 2, can you do the other part of this, for example. In the past, what we did is we work on abstract submission. We have teams, and in these teams, members from all over. Some people in Saudi Arabia, for instance, Egypt, and some in the US. And some of the conferences, they want to have a person who is present. So for these conferences, we wanted some of the fellows to be present in the US so they can go in person and present that poster, for example. So you want to make sure your team will have, let's say, a member who is residing in the US, for example. But for this project, it's mobile application development. So what the purpose of the project is here to monitor the symptoms for patients with asthma, for instance, for this project number 201, and maybe some features. So you can start with basic features, and then you can add more features for your app. And I created the prompt for you. You can modify the prompt the way you want. So I'm gonna be the project leader for this, and I'm gonna submit the abstract, let's say. So my name will be listed here. I have the prompt. If I want to, I can copy paste this title in the WhatsApp group and see who is interested in joining me to form a team. At some point, you may not find some people who are interested in the same topic. Let's say people are not interested in asthma. You are the only one. So for example, I'm interested in this and I didn't find anyone else to help me. So I'm gonna just use this prompt and I'm gonna go to Canva and let's see. When you go to Canva, the box here, you can hit Canva AI and copy paste that prompt. As I said, you can modify it the way you want. And here down, there is a code or code with me. You hit that and you hit submit. What it does, it will write basically a code program that will display an app that can be used by patients who has asthma, for example. So this is one way of doing a project. So there are 5 projects for patients with asthma. You can select any one of them. And you can modify the same prompt for patients with different disease. Let's say you are interested in anything else, let's say diabetes. So you can say create an app for patients with diabetes, for example, and so on. It will write the whole code for you. And after it's done, it will show you the final product, which is like the app itself. And that app can be displayed in any device. If you have a tablet, it can be like used. If you use a PC or computer or laptop, it can be displayed and used on that device. Or if you have a mobile like a phone, you can use that as well. So it's gonna be like a web page basically, but you can make it interactive. So the user or the patient, in this instance, patients with asthma, they can use the app on their phone or on their computer or laptop or iPad, and they can click on what they want to add. For example, the symptoms. Every day they can just monitor their symptoms and triggers and so on. And by this, they can collect some information and they can share this information with their healthcare provider. That way, you develop an app that's user-friendly and that can be used by patients with asthma. So this step, we call it prototype. So Canva can help you develop a prototype. It's just the basic, the first version or the beta version of your app, and you want to make sure it's functioning. So the prototype, you want to test it. To do that, you can just click on each buttons, see if it moves from one page to another, one display to another. You see if there is like a icons, are they readable, the text, this Is it moving from one view to another, for example? So medications, this and so on. Sometimes it doesn't. If it doesn't, then you can try to fix it here. But for me, it's working now fine. If you are happy with this first version, then you want to publish it or use it in design. So if I'm happy with everything looks fine for me, I'm gonna just click on use and go to website using design. And as a website, it's gonna show the same thing. And the next step is to hit on publish as a website. So this will ask you for a site address. For me, I reached the limit, but for some of you, it will be available for you. Like you cannot just change this, or you can keep it and hit submit. When you are done, it's gonna be ready for you, like this. It will have a website here. This is a website for other patients or other people to look at it, for example. And you can share this with other people. It's going to be working fine for them, and they can give you a feedback. Let's say some of the other users will try it and say, oh, the last part is not working. So you go back and you want to fix it. So this is the first version of the app, or the mock app, or the prototype. Any one of you wants to do any of this? So I'll go back here. So these are some of the projects that, so if you want to track something, you will have more of the, for example, people who want to look at the environment, they have another feature of developing this app. You do the same, you just copy paste this and go to either ChatGPT or Gemini, Grok, or DeepSeek. And for example, you can go here and you can say, improve this prompt. So this is basic prompt. I want to have a functionality or something. So it will help you as far as the user is concerned, or other component or other functionality that it can add to the prompt. So it depends on what you want to focus on. So I'm gonna say number 3, for example. I want to focus on mobile design. So it will give me an option. And here, do you need a prompt, different type of, let's say, I want all this. So it's gonna create the prompt for me. So I want to use it in Canva and so on, if that makes sense. Any questions or any comments? Do you think it's difficult for you guys to do this, or it's cumbersome, or something that prevent you from doing it? Challenging? I need your input, guys. Any feedback? Your personal aspect or perspective of this.
It's very useful tools. The thing is like, yeah, how it's a little bit like, to me, I have like a little bit literacy how to do those things. So Yeah, if there is a group or guidance and we have a start point, that would be very fun.
Excellent. So the start point is there. So if you go to the app, you click on the whatever project of, I think it's 201, 203, 200. So if you go to the project, you can go down and you will find it somewhere. This is by number. So if you want to, any one of the 200, 204, for example, 209, for example, 200, I think 10. So all this can be found. So if you go there, this one will just work. You will have the prompt and you copy paste this prompt into whatever Canva, ChatGPT, Gemini, and it will create the app for you. So this is the first basic concept. If you did these 2 steps, you go to the app here, you select the project or the prompt and go to the Canva or any and paste it there. So you don't have to do anything else. It's gonna show you the app and it's gonna create this for you the same way I just showed you. It's gonna take you less than 5 minutes, couple of minutes to select the project, couple of minutes to run the prompt and the code for you, and you will have the product out there. If you do that, let me know. I can show you the next step forward. So the first part is to create this page for you. It's not difficult. It's only 2 steps for you. So any one of you can try that and let me know if you have any difficulty or if it's overwhelming or if it's challenging for you. I don't think you went through 4, 5, 6 years of medical school. This is nothing for you guys. If it's coding and recoding and typing and other technical part, maybe it's going to be over your head. But this is just double of clicks, copy paste, and the computer will give you the product. And the good news about it is if you do it, you can talk about it, you can put it in your CV, or you can talk about it during the interviews. So they may be interested in how you are using AI, how you are developing an app, how you are trying to solve a problem, how you are trying to help your patients. So all these will distinguish you or will put you in a different level compared to other applicants when you apply to this residency program. So you will be shining as an innovator or shining as someone who cares about your patients. You want to use recent technology to improve the health and wellness of your patients and so on. Thank you. Anyone wants to share?
Thank you, Doc.
Why don't you guys try it right now? Go to the web app, web, and see if that's doable. Right now, I'll give you a couple of minutes and we'll see how you do it right now. So you go to the app, select any of the patients or the app with asthma and see, let me know. So before we end the meeting, I just want to have your input. What we are trying to do is we have the Telegeriatric Research Fellowship, this program, and we created a foundation, like an umbrella, that will be an organization that in the US system. So legally, we have some protection or some identity that we are affiliated with. And with that, we can communicate with other institutions in the US or abroad, and then we can collaborate, and hopefully we can improve our like output as far as learning process for you guys and training and for your patients in the US or other places as well. One idea for me is to create or to develop the telegeriatric research program itself as an entity and register it here in the US. What, if you have any input, what do you think about that?
It's great to hear that, really, Dr. Nader. And we are here to help if you need any help in this. I don't know what our part will be, but we are ready.
Thank you so much, Dr. Raza. Yeah, the process itself is not difficult, and I just want to make sure it will help you guys. So in the past, we created the program along with MSU. Now we are separated from MSU. So we want to make sure it's functioning well for you guys. And hopefully we'll improve and go in the right direction. I think if we register it, it's just paperwork, I think. It may be good compared to being a part of the foundation. So by itself, it will be also looking good. We are not gonna separate from the Combined Research Foundation, but will be part of it and an identity that's also recognized by the US government. Thank you.
I think this is
That's
great
great.
idea. Yeah, thank you.
Great,
Thank you,
yeah.
really. Yeah,
Thank you.
we're encouraging.
Dr.
Yeah,
Thank you.
Thank you, Dr. Nahid. Thank you so much.
You're welcome. Thank you both.
I have a question.
Sure.
So yes, what you've said is really great. And what I just want to make sure that I understood you well. So you want to register the fellowship as an independent?
Yes. So it's going to be an independent identity. It's going to be an organization, basically, legally recognized by the state here in Michigan. And if we do anything, it's going to be legal to whatever do it across the country here. It will be recognized, and it's not going to change what we are doing now. It's just another layer of protection with all these changes happening to make sure we are following the regulation or the rules or go by the law. Right now, we have an umbrella that protects or that cover the telegeriatric. But if it's by itself an identity that's recognized, I think it's better. My thinking in the past that when we created the foundation, the umbrella, is that this program, the telegeriatric, will be, let's say, reproduced in different format. So because the telegeriatric is focusing only on geriatric population, maybe some of you will be interested in, let's say, mental health or pediatric. So it doesn't go along with geriatric, but it will be a separate. So the umbrella will have the geriatric fellowship, and then we can create a new fellowship for pediatric. Maybe some will be interested in neurology, then a third fellowship will be neurology, and so on. So the umbrella will be there to cover or promote or help assist all these small fellowship programs in the future. So let's say next year we want to develop a new program, it's going to be under the umbrella. But what I'm thinking now is these small programs or the fellowship itself, and if they are new fellowship, I think it's better to register them in the US government as identity, but it's under the umbrella, if that makes sense for you guys.
Actually, that would be great. And I'm sorry to ask this, the umbrella that you're talking about, is it the Research Foundation or?
Yes, so we have created this for 1 year now, the Combined Research Foundation, and it's registered in Michigan and it's recognized in the US, and it's non-governmental, non-for-profit organization. So we have all the paperwork, everything in place. So we just want to make sure the telegeriatric itself is in a good position legally, what I mean.
Yeah, I think that will open many doors for others, fellowships, geriatrics and other fellows. I think this will be amazing if we can do it. And as the other fellows said, we're ready to help. So yes, thank you so much.
Thank you so much, all of you. Thank you, Dr. Arij, and thank you, all the fellows. Any other questions, any other comments, ideas, or suggestions?
Yes, doctor. I went through the projects. I added myself to improving medication adherence in elderly population through mobile health application. Then what's the next step?
So if you open it, are you using your phone or you're using?
Oh, it's my
PC?
phone.
Okay, so I'm gonna try to use it here. Let's see, I can help you. What's the project name again?
Okay. The project name is Improving Medication Adherence in Elderly Population through Mobile Health Application.
This one. So you have a group of project members here. So most of them are team members here. Dr. Ayman wants to be a project leader, and then Dr. Namarta is co-leader, and so we have 2 leaders in this project and a lot of members in the. So what you need to do is you need to reach out, send an email. This is her email or Ayman's email, and see what stage is the project they are doing right now. Let's say they are writing and they are in the middle of collecting data or finalizing the abstract. So you see what task they are still working on and join them and see if you can handle this task. And then are you in the US or you are overseas?
I am in the US.
So mention that so that if, let's say, they are planning to present this project as a poster submitted to a conference here in the US, you can be part of the team so that you can go to the conference and so on and present it as a poster. If the whole group working to submit it as a paper, see if we want to be the submitter, author or something like that. So we have different tasks in this project. So ask the team leader, any one of them or any one of the members, and see how far they are on the project and see what part you want to take, and if you want to complete the task with them and see what the final product, and then we can talk about what the next step as far as submitting it to a conference as an abstract for presentation as a poster, or submitting it as a manuscript to a journal, and what will happen next. Thank you, Dr.
Sounds
Rania.
good. Thank you so much, Doctor. Thank you.
You're welcome. And remember, every one of you, you can join us if you have time, as many projects as you can handle. So your part of this project will be task. So you handle one task of the whole project, and you will be part of the team of that project. So if you have time, you can join different projects and see. You can be a member where you only take one task or a couple of tasks, or you can be a manager for that project, or leader for that project, or co-leader, where you will find out the task and identify the people who are interested and assign this task to the people. So you will be like putting a timetable. So in 2 weeks, we need to collect the data about this whatever topic. So you identify, I want you, Reed, Nahid, Yusra, to work together on getting the data. So we will meet in 2 weeks. In 2 weeks, you will meet together and see how far you collected. And next step, I want you, Dr. Mohammed, to work on writing out of this data, analyzing it, and writing the introduction and the body or the results. And then we'll meet in 2 weeks. So in 4 weeks, you will have the data collected. You read a part of the project. Next, you're gonna say, let's write together the conclusion. So all the team members will put in their input as far as conclusion out of this collected data and the results and so on. So you will be just handling the people or fellows task and the timetable, and making sure by 6 weeks the project will be finished. When you are done, then you will identify a person who will submit that as, let's say, an abstract to a conference. So you will target a conference, that person will register for that conference, and then they will submit all the necessary documentation or files to the conference, and then they will be in contact as far as communication. They want more information, they want to do this, that. They have a person in your team that's the communicator or the submitter for that. If you are submitting to a journal, then make sure you have the leading author. And one of the things for the leading author is to make sure you are meeting the criteria for submitting that article or the manuscript. So if they want to have limitation of tables, they only accept 2 tables. So make sure someone is reading the guidelines and follow these guidelines. And that person can submit, or another person can submit the manuscript to the journal, and then they will be in communication. As far as if there is a review, they will be the person to communicate with them. They will get the feedback of the review if it's going to be accepted, but they want more editing or more information or so on. So one person will be the communicator between the team and the journal, for example, if that makes sense.
Yes, definitely. Thank you, doctor.
Thank you. Anybody else with
Hello,
questions?
Dr. Nader.
Hello, go ahead.
So I opened the project list on the app and I tried contacting the team leaders on many of the projects, but I haven't heard back from them. So I'm not sure what I should do at this point.
That's all right. So sometimes what happened, so I know, let's say the same project that we were talking about, one of the leaders, I think she was accepted and she started her residency. So if you don't hear from the leader, that might be the case, or maybe there's different reasons. So in that case, you want to communicate with other members and see what they are doing or how far they went. Some of these projects, let's say they put their names, they are interested, but there is no leader for the project. So the names will be there, but nobody took an action because whatever reason the leader, let's say, join a residency and they are not available anymore, or they have, let's say, they were in Sudan and the war become a problem there, and they are not able to communicate and so on. So if this is the case and you communicate with the team and you find out that the team did not do anything, maybe you can step up and become the leader or the project manager for that project. In that case, let's say, communicate with them. I want to see who is actively available, and we're gonna create a WhatsApp group, for example, or email communication form where you will be communicating with other fellows in the group and this team using either WhatsApp, phone calls, or emails, and see who will be the leader. If you want to lead that team, you'll say, I'm available and I can lead the team. You can have someone also available. They can be a co-leader for you, or you can be the only manager or leader for that team. So what's your job is to see who's available currently or in the future, because sometimes you might have fellows who are available and other fellows who are taking, let's say, step 3 in a month or 2. So for the next second group, they will not participate with you as much. So in the coming 1 or 2 months, but the first group, they are available. So when you are the manager or the team leader for the project, you want to identify the task and assign this task to the first group who are available at this time to do the task, to complete them. And then after you are done with the processing of, let's say, data collection, analyzing, then you ask the other group in a month or 2, when they are done with their step 3, for example, they will be available to participate. In that time, they can work on finalizing the text or the conclusion or the whole thing. And some of them might be available to be the submitting author, some of them might be presenting author, and so on. So your job is to basically organize, making sure every piece is in place and assigned to a fellow or couple of fellows, and they are doing that. And you set timetable. So in 2 weeks, we need to finish this. In 2 weeks, we will finish this. In 1 week, we will, if that makes sense. So this is kind of the plan, and who is involved and what time they are available, what tasks they will do, and you take it from there. So my suggestion is to contact all, see who will respond to you, and out of these people who responded, who will be available, what period, and who, if any, wants to be co-leader, who will be submitting author or communicating in the future. After you find the active member in the team, then ask them, I want some to work on this piece or this part of the project, and then in 2 weeks we want to work on this piece or part of the project. In 4 weeks we will be doing this. So you divide it into small tasks and timetable for that task to be finished, and then hopefully you can achieve the whole project complete and submit it to either a conference or a journal and so on, if that makes sense.
Yeah, okay, I'll definitely contact the other members. Hopefully one of them replies. Thank you for the suggestion. Yeah.
You're welcome. Thank you. Anyone else? Any other questions? Anyone of you did a look at the mobile app or the ones that we just discussed and tried it?
Yes, I copy-paste the prompt and tried coding it, and the app showed immediately on Canva. So I think it was pretty easy. But for me personally, when I tried Canva for my own personal mobile app, it was very difficult at first. So I think there's a problem with my prompt itself. I'm going to redo it again. Maybe next week I'll get my own personal mobile app as well.
Sounds good. So you got the idea now.
Yeah, it's very easy now. I think maybe the prompt should be written clearly for the Canva to create the app, I think.
Sure.
Yeah. So after that, I'm not sure what else I can do with the asthma mobile app. Yeah.
So if you want, in the coming days, you work on your personal or whatever you did now. And next week, maybe you can show us during the update what you completed. And then I can go through the next step of what we can do with whatever product that you reach. Let's say you have the app working fine, you tested it and everything okay. Then show us how you did that and what's the output for that. We can give you some suggestion. Hey, maybe the color is supposed to be this or this, whatever improvement, or maybe we can add some features, whatever. But the next step, let's say we are happy with what you have, then there is a couple of other steps to what we call move it from basic just app to a functioning app that can be published to the web, let's say Google Play Store or Apple Store or whatever. There are different other stores so that patients or users can access it, download it, use it, and then they can give feedback or ask for more features. So these are the next part of the we can talk about it when you present the first step. So I want every one of you to do this, the first step, which is copy paste these prompts for any mobile app. You can modify the prompt the way you want and then see what the product. If you reach that, that's a big step for you. And you can talk about that by itself. This is achievement. Then it's like writing an abstract. If you have the idea, you write the abstract, that's by itself. You know, there is a background, there is data and results and methods and conclusion. If you know this, you wrote anything, then you have an idea about what you will be talking about. So I want you to achieve what you did just now, Dr. Noura, is the 2 steps. Copy the prompt, paste it, see what the output result, and then you can modify it according to whatever thing you need. So if you copy paste the asthma, and it has the output the way we showed you, but in real life you are working with patients with diabetes, or you have a family member with diabetes. So for you, it's meaningful to have an app that can be used by your family member or your patients about diabetes, not asthma, for example. So next step is to modify the prompt. Instead of patients with asthma, you say patient with diabetes. It's going to be more or less similar to the one we showed you, but it has, instead of the asthma symptoms, it's gonna have input for the patient with blood sugar, and can create graphs and so on, something like that. But that's the next modifying step. You don't have to do that. I want you just to do the first step. Recognize that it's doable, it's easy, it's gonna take 1-2 minutes, 5 minutes max to have a product. And this product, you can talk about it. And then we can, next week, Dr. Noura, if you are available, maybe you can show us what you...
Yeah, sure, inshallah. Yeah.
Inshallah. Anybody else wants to try and do the same? Maybe you show us next week.
How are you?
Hi, Dr. Wala.
Yes.
Go ahead.
To do that in a dental app before you told me, but unfortunately I didn't get the whole information and I stopped in the middle. I didn't. Do you hear me?
Yeah, go ahead.
I didn't get the whole information from the app. I don't know, because I think I lost the communication at that time. If I want to go for the whole information one more time from that, told me it's not a publish in Google Store or something like that, but any idea to modify that app one more time to help to redo it one more time, or to do another one same like that. So how can I do that? Because I didn't find the whole information between the team that was working at that app.
Okay, so my suggestion is to come up with what's your idea about the app. You don't have to go do the same, repeat what they did, because I know what happened with that app. For some reason, they were successful in developing the app and uploading it for a year or so. But for some reason, the Play Store, I think it's Apple Store, they removed it from their website.
Oh yeah, there is something happened at that time. Yes.
Yeah. So sometimes they, I know one case in other app in Google Store, they communicate with the author or the one who upload that app, and they want to verify more information. Let's say they want to have a copy of their passport or whatever. And if that communication is not there, then they will say, oh, maybe this is a fake app, or maybe there is no person to contact, because users sometimes they will give feedback or questions or something. So if there is no valid person, then the app will not be valid, something like that. So they will remove it. Or if they want to update and they want to communicate with the author and no one available or whatever, then they will remove. So there are different reasons. I don't know exactly what happened to the apps we published in the past, but I think most of them, they are not available now. So the idea is to come up with your own new app for dental. If you have some features in the previous app, or if you have new features or anything that you think might help your patients, you can ask ChatGPT to get some features if you run out of ideas. So basically, you want to create a prompt to create the app for you, similar to what we showed you now. When you have that prompt, then we can go the next step of how to develop it into mobile app that can be published again with a different feature of different version, either in Google app or Google Store Play app or Apple Store. So if you want, you can, inshallah, see if anyone interested in the dental group, if you want to do it alone, if there is nobody, or the other medical group here, if anyone interested, they can join you. And their part might be just testing the app for you, if that makes sense.
Sounds
so you
good.
come up with the idea, you do the prototyping, and then see if any of the fellows are available to test it. And then if we reach that point, then we can talk about the next steps.
Okay,
Thank you so
sounds
much,
good.
Dr.
Thank
Wahab.
you. Thank you.
You're welcome. Yeah. Anybody else, or any questions, comments, suggestions, ideas? If not, I'd like to thank you all for attending today's meeting and your input. Thank you, Dr. Mohammed Makkawi, for presentation, great one. And thank you for those who will come later to watch the recording. I wish you all the best, guys, and we'll see you next week. If you have questions, please email or contact me via text or WhatsApp. I'll be to help as much as we can. We'll see you next week. Assalamu alaikum. Fi amanillah. Salam.
Assalamu alaikum. Thank you.
Thank you. Thank you, Dr. Nader.
Thank you, guys.
Thank you, Dr. Nader.
Anyway, thank you. Anytime.